We know your time is valuable.
That's why we've created processes to keep your job running smooth.
We know you expect 5-star service.
That's why we're committed to delivering 7-star.
We know it's your home and your choice.
That's why we provide options and let you choose the right solution for your home. Experience the LCS way with LCS Heating and Cooling at lcsheatingandcooling.com.
Outside the Forecast on WTHR Plus is sponsored by LCS Heating and Cooling.
You can see just how hazy the sky is behind me. That's from the wildfire smoke coming in and setting on top of the city. I'm standing on the top floor of a parking garage right now downtown, and people say that haziness is making it harder for them to breathe. Bob Welch bikes every day, and the poor air quality is not stopping him.
I've noticed that the air particulates are aggravating my sinuses. They're aggravating, and my throat's really kind of sore.
He even went to the ER for his symptoms.
That real cool air than hot air. Cool air sometimes it's nice and crisp, and all of a sudden, it kind of chokes you a little bit.
Lucky Columbro feels it too and can't avoid the haze. Walking is her main mode of transportation.
Especially in the heat, with air with who knows what's in it, from the wildfires. Made me a little nervous.
Columbro started using her inhaler at least once a day.
It can be really dangerous even if you don't necessarily see it and there's no fire in front of you. It doesn't mean it's any less harmful.
This view from the pagoda at Indianapolis Motor Speedway shows you just how dense the air looks. Indy's skyline more like a shadow.
Try to reduce your exposure as much as possible to the outside air.
IU Health pulmonary physician Dr. Alan Hislop explains it's the particles in the blanket of smoke over the city that hurt your lungs.
Particulate matter, some of it, even though your body does a good job of getting rid of, it does deposit deep down into the lungs, and it can cause a number of inflammatory events that trigger symptoms like wheezing, coughing, chest tightness.
He says even the healthiest of people can feel the effects.
But I would imagine that if you're outside for, say, a handful of days for a number of hours, it probably is the equivalent of smoking a handful of cigarettes to maybe even up to a pack.
A veil over the city no one wants to see or feel. In Indianapolis, Ella Rhodes, 13 News.
Well, as you know, air quality and wildfire smoke has been a big part of our story, not only the last couple of weeks, but unfortunately the last several years, and that is a trend that continues. So we're taking Outside the Forecast on the road this week. You see us show you the smoke plume maps and the air quality numbers, but we've got an expert here at IU Health, pulmonologist Dr. Alan Hislop. We appreciate you joining us for your expertise. Listen, I know for folks that are asthmatic, have pre-existing conditions, I think they chart those numbers rather closely. I want your message for the healthy person.
Yeah.
What numbers should they be looking at to maybe reconsider that long run or exercising outdoors?
Yes, certainly. So when it comes to air quality here, especially in Indiana,
yeah,
I think most people, as you point out, since the wildfires from years ago, people have been paying more attention to the number. I definitely think even any number is obviously of concern for anybody, even if they're healthy, but underlying lung conditions. But as you start to get to the 50, to the 100, that's when it becomes more noticeable that if you just start developing wheezing, coughing, chest tightness, shortness of breath, that's when you should take a pause and maybe not go outside that day.
Is there a way to quantify, maybe there isn't, but because sometimes I think it's easier for the random person to, if you can say, hey, if you're outdoors and you're exercising for 3 hours with a number of if the AQI is 150 plus,
yes,
you're smoking X amount of cigarettes a day. Is there a way to quantify it that way?
Yeah, I mean, it's a great question because I think most people, to the general audience, they don't know what's in the air at that time. So obviously there's particulate, which is a number of different things, but there's other different chemicals and gases like oxides, ozone, volatile compounds.
Yeah.
So all those things you're breathing in, and it's hard to say if that's the equivalent of like one cigarette, half a pack, but I can tell you that the longer you're exposed, as you pointed out, it probably is equivalent to probably just basically smoking, some form of cigarettes, whether that's, like you said, half a pack to a pack. It'd be almost kind of like, with a tailpipe exhaust, kind of more so, if I had to guess.
what length of time are we talking about for a healthy person if they say, you know what, I'm strong enough, I can overcome this? Are we talking, hey, if you go out for 5 days and you're doing this hard workout, what length of time would it take to create some long-term effects?
That's another fair question. I would say it's probably, your lungs are very good at removing the particulate, and the immune system that you have, the defense, it's very good at trying to filter that out, just like any air filter in your home. But as you know, like the more you're out, more exposed, that filter system can get overworked. Okay. So to put a number on it, I don't have an exact number, but I would imagine that even if you're exposed for a handful of days, even to a week, you could probably start noticing the health changes within your body pretty quickly.
And I think it's safe to say, listen, I mean, if we know some people, they maybe their job's outdoors, so they have to work. I think it's probably safe to say that, hey, if we get to a certain level, maybe if it's in the hazardous or the purple zone, you probably should be wearing a mask.
Yeah, that's again a great point. I think obviously not all masks are equal, as we know. There's different types of brands. There's N95, N99, even a P100 that you can get from Home Depot or Lowe's, and some do better jobs at filtering out certain particles and certain odors and gases. But yes, when it gets to that high, I think it would be reasonable to consider all personal equipment or protective equipment to help you breathe better.
All right, we appreciate the expertise. You heard the man here. We appreciate your time. Listen, we still had a long way to go in the fire season, so unfortunately we could have more bouts of this. I'm just ready, personally, for some wind chills at 10 below, but that's just me. We appreciate you tuning into this week's edition of Outside the Forecast. Stay safe.
Outside the Forecast on WTHR Plus is sponsored by LCS Heating and Cooling.